Dr. Martha Kingman, let's talk about a subject near and dear to your heart, and that is the important role of the nurse practitioner in the diagnosis, treatment, and overall care of the PH patient.
Okay, thank you. That is certainly a topic I'm very interested in. Pulmonary hypertension is such a complex disease, and also the disease treatments that we have are very complex. And as I mentioned before, it really does take a village. It takes a team, an integrated team. And I will tell you one thing that I'm very happy about our program is that the physician relationship with the nurse practitioners and the PAs as well is excellent. I'm able to work at the top of my license. And I think that in some cases that's not always how programs are run, but ours is done, I think, very, very well. The physicians are our physician sponsors, and they are in charge of the program and the patient's care, certainly. And we work in collaboration with them, but also fairly independently on the outpatient side especially. So my role in clinic is that I see patients. I have my own schedule. I see patients every 30 minutes all day long, and I do everything. I interview them, I do their physical exam, I order their tests, I evaluate their tests, I talk to them about treatment changes or advancements, I prescribe medications, and then follow them up as well, and sometimes even if the time comes, refer them for transplant. But what's really great about our relationship with our physicians is that they are either in clinic with me if I have any questions or a phone call away, and always readily available and very supportive. So if I do end up in a situation where I may not be sure or have a question, it's very nice because I can quickly get that question answered, literally while the patient's still there even. And then a lot of my role is also involved in the between patient visits. So we have the 3 full-time nurses that triage all the calls that come in or electronic medical notifications that come in from patients. And many of those issues or questions they're able to answer because we have some standing medical protocols. And others, they will escalate to me. And then in most cases, I can address those issues that need to be addressed. But then there's a few cases where I say, gosh, I'm not really sure, send it on to the physician. And so we just work really, really well together that way.
So it sounds like an important aspect or a component is that not only do you have the nurse practitioner role, but you're using it properly.
Absolutely, yes. And it's great job satisfaction for me, and I think that the patients also understand that. When the patients first come, they always see the physician for new patient visits, and then we take turns. So I'll see the patient, and the next time the patient sees the physician, and I think that we each have a little bit of unique things that we bring to the visit. So patients tend to be very happy with the way we run our clinic that way.
Very good, the way it should be.
Yes. And then on the inpatient side, we have 2 nurse practitioners and 2 physician assistants who round on all the inpatients, and then also the patients who are hospitalized see the physician every day as well. But the nurse practitioner or PA will see them early in the morning, make sure that they've reviewed all the testing, lab results and things, make sure orders get placed early, and then when the physician goes around, they can make sure that everything was done correctly and oversee what's being done.
Let's talk about the goals of the patient and the provider.
Oh, I'm glad you asked that because it's an interesting topic because those goals that we have and the goals that the patients have often diverge. For instance, as healthcare providers, we're very interested in the clinical aspects. We want to know what the right side of the heart looks like, if it's getting bigger or maybe not pumping as well. We want to know the hemodynamics and the cardiac output, those kinds of things, which don't really resonate too much with patients. What patients want to know is, are they going to be able to attend their child's soccer game? And we had one patient who specifically wanted to be able to go to dog shows again because she's training her dogs. And so we have to be careful when we're talking to patients to not just focus completely on the clinical aspects, but to also make sure that we recognize what the patient goals are and that we're always working toward their goals. And that's become really a kind of a hot topic in pulmonary hypertension now, to where each time we see the patient in clinic, we should be asking what their goal is and how we're progressing toward that goal, and not stop until we reach the goals for the patients, what's really important to them.
So now the role of nurses with the specialty pharmacy.
Yes, they're involved in the follow-up of patients. And when patients are started on advanced therapies, especially IV therapies, we also have one that's called a subcutaneous therapy. Those carry with them a lot of challenges. There's side effects, there's a lot of interventions that need to be done, and regular contact with patients. So those are done both by our nurses in clinic every week or two when patients are started on these therapies. They either contact them by phone or through the electronic medical record. And then the specialty pharmacy nurses are great to have on our team because they actually go into the patient's home. They do the initial teaching there, and then whenever we need them to go back, if we have some concerns that maybe the patients aren't completely clear about the process, they'll go back and reteach at any time. So it's nice to have those eyes on the scene in the home to really get a good idea of what their home environment is and their social support and how well they're adapting and adjusting and learning the process.
The epitome of comprehensive patient care.
Yes, absolutely.
Thank you, Dr. Kingman. Sounds like the ultimate in comprehensive patient care.
Yes, absolutely.